You happy for us to make a start, Dawn, and people can just kind of filter in?
Yeah, I was just checking the chat to see if anybody else. Looks like we're fine to go. Thank you.
That's all right. So yeah, hi to everyone who's here in the Cancer Care Review breakout group. My name is Steve. I'm a GP, a very warm temperature-wise GP today. I work in Sale, and my role, well, why I'm here is I'm also the primary care lead for Personalised Care for Greater Manchester, or GM Cancer. So my role, a big part of my role, is kind of trying to push the agenda on cancer care reviews and see what we can do to help increase both the quality of these as well as the kind of engagement with it as well. So what I was hoping, I've kind of got two main reasons anyway. One is to give a bit of information about cancer care reviews for those of you that are interested, which I assume is those here because you've picked to be here, but also to get a bit of information from you guys as well about what would be beneficial in terms of any kind of learning or training or teaching kind of opportunities that we may be able to offer from GM Cancer. So I have a few slides which I will just try and rattle through, not too slowly, and then just about cancer care reviews. But then what we will do is say hopefully have a bit of a chat, if possible, about what again we can do really to help people and support people doing cancer care reviews. So just yeah, that's me and that's today. Brilliant. So I say just quickly what we'll cover: why personalised care is important, a little bit about QOF, don't switch off yet, I promise it'll be very brief, what makes a good cancer care review, and what support do you need. So again, that's what I'm really keen to hear from you guys. So why personalised care? So I've just got a few things flicking up on the screen which you can read, and what these are the kind of percentage of people who've been diagnosed with cancer who after 6 months after diagnosis are still living with certain kind of sequelae of that cancer. So whether it's being, say loneliness, or the huge percentage of people who are financially less well off, there's lots of maybe non-medical or perhaps non-clinical aspects to their care, which is what we're interested in. And just a few quotes as well that patients have often given following this transition, sometimes after their initial cancer care, to then moving into maybe the living, what used to be called, I think, living with and beyond cancer. We now call it personalised care, and how we manage these people for the years and years that they either do or don't have cancer, but with the effects of that cancer and its treatment. So this is the why really is important. So again, a quick bit on QOF. So again, I won't try and go too far into this. So there's 2 QOF indicators that are relevant with regards to cancer care reviews that you may know about. So, and in a difficult way, CAN05 and CAN04 are the wrong way around. So CAN05 is kind of the first one, which is this 3-month review, I put in inverted commas. So this is what they call a cancer support discussion. Now, this is not a cancer care review, but it means anyone who's had a cancer diagnosis within the last 12 months, within 3 months of that diagnosis, should be informed of any support available to them. Now, that can be a phone call, that can be an appointment, it can be a text message, it can be a letter, it can be an email. There's no structure of what it has to be, as long as patients are informed of what support is available. Now, that may be a link to the Macmillan website, that may be a link to Cancer Care Map, which can help find them support for specific symptoms. How far you want to go with it as a practice or a PCN is up to you, but the key, the milestone as such, or the tick box, is that some information has to be offered. And again, as long as that is done, I think it's perfectly fine to send a template Accurix message just saying, we've heard about this, here's some information you may need, or a lot of practices have a letter. So that's the 3-month, sometimes called the 3-month review, but it's not actually a review. Then the other one is CAN04, helpfully, the wrong way around. This is what we often think of as the main cancer care review. So for patients to have this within 12 months of their diagnosis, the look back for QOF is 24 months. But this is within 12 months, and it's not for us to say when that is. It could be at 1 month, it could be at 11 months. It's about when the patient feels it's right for them. And this is the kind of meaty aspects of the cancer care review that some of you may be familiar with. Try not to make this too confusing, but just how this kind of, the CAN05 and CAN04 fit into the whole pathway of patient journey. So you can see how I'll just use my cursor here. So when they present, they go through the referral process, they go through hospitals, H&As, you may have heard of holistic needs assessments, which are done by secondary care normally. And then they have their treatment, And then this kind of purple line here is often when they leave secondary care sometimes. They then come into primary care and we have their initial support discussion. They then finish their cancer treatment potentially, and then they have their cancer care review, not at 12 months, but by 12 months. And again, it depends on when the patient finds suitable for them. So the two main things we're looking at here is this cancer support discussion, CANO 5 and CANO 4, which is the cancer care review. Okay, that's all I want to talk about from that slide anyway. So why are we doing them? So one is to identify unmet needs. So a lot of cancer care reviews often are, how are you getting on? Any problems? No, great. And sometimes that will be done. You know, I've seen it happen. I'm sure other people may have as well. They get kind of added on at the end of perhaps a GP appointment, and they just kind of tick the box that says, are you doing okay with your cancer? How's your chemo? It's not what a cancer care review is about. It's about looking for those needs that maybe haven't been mentioned before. Things that people might find difficult to bring up. Things like incontinence, anxiety, depression, sexual dysfunction, things that are really important to patients, but unless you actually ask them directly and say, you know, how is your sex life, they might not really want to volunteer that information. So that's why these are really important. And you're not really going to get that just at the end of a conversation or consultation. There was that word slump that was kind of mentioned earlier, this time when people come off from secondary care and come into primary care and they feel sometimes a bit abandoned. So we're trying to prevent that slump as such. There's a bit of reviewing medications as well, but again, that's not kind of my personal emphasis of cancer care reviews. And then signposting is really important. So I think we're all aware that patients will have lots and lots of varied symptoms, and I'll go through a few of them, or side effects from their cancer treatments. We're not expected to know, and you're certainly not expected to know where they go for all of them. So it's about recognizing where you might be able to signpost them to, or if not, taking the time saying, look, I don't know where that is at the moment, but I'll have a look into it, or we can look together on Cancer Care Map, and we can try and find the right place for you. And generic lifestyle advice, you know, the usual diet, exercise, stop smoking, alcohol reduction, all these things will benefit them in terms of really reducing the risk of recurrence. So that's why it's important. So what makes a good cancer care review? So there's a couple of new training resources, one by Red Whale, which I think Sarah Taylor mentioned earlier as well, which is a really good resource, about half-hour video, which is free. You don't need to be a member to access it. So there's a Red Whale one, and there's one on the Macmillan learning portal. I think it's called something else now, but they've got two new sections on there, which are really good for cancer care reviews. And one of the ones they're very key on is preparation. So it's important to be proactive. This isn't about waiting for the patients to come to us and say, oh, I think I'm entitled to a cancer care review. We should be offering these. It should be a separate planned appointment. It shouldn't be something tagged on the end and just said, oh, you know, fine. If you want to do it as part of a chronic disease management appointment, fine, but it needs the additional time for it. It needs to be something, and the patient needs to be aware, which follows on to this questionnaire. So the ideal cancer care review should have a questionnaire in advance. Again, when I mentioned about problems with sexual health, problems with mental well-being, those things often get easier prompted when patients put them on questionnaires because they feel a little bit less embarrassed about them that way. So for our cancer care, well, for my cancer care reviews, I'll always send them. It's on Accurix already. So if you have Accurix, great. You can just send them out a questionnaire and it asks them to put in what's important to them. So when they do come in for that cancer care review, you can know exactly what's coming. And maybe if you look at your list the day before, you can say, oh, I don't know, they want to talk about hair loss or they want to talk about sexual dysfunction. I might just have a quick look to see where I would signpost them, and it gives you a bit of a heads up. Paperwork. So it's a bit tricky at the moment, but most patients should have a holistic needs assessment, an HNA, and a treatment summary from the hospital. Now, by far and away, most patients probably won't have these, but the more paperwork that you can get for them in advance, the more you'll know. If you know they've got existing issues with incontinence or existing issues with mental health problems due to their cancer, it makes, if you then kind of approach that with them directly, it also makes them feel that you know the story, and we know that patients like it when we know continuity. I'm sure it's the same for everyone. How many times patients say, you've probably looked at my notes, haven't you? You've looked at my notes, you know all about me. It's like, no, probably not. But if you have that time just to understand exactly what's already going on for them, they don't have to tell you all the story again. So some of that will be available in your DocMan or wherever you use. But say treatment summaries will becoming more frequent occurrences. You'll see them more over the next few years. So basically preparing for these, just not doing it ad hoc. So using a structure can be useful. I'm not a big fan of using structure too much. You may have seen this, it's a bit longer than this if you've done a cancer care review. It looks a bit like this on the Macmillan cancer care review template. Yeah, there's lots of tick boxes there. To me, it looks a bit messy. It's important for the kind of the quaff overlords that we complete it on this, but I think it's more important that we address what the patient's concerns are, and if their concerns aren't on here, I'm more interested in what's wrong, what the patient thinks they want to talk about than what I want to talk about. So yes, use the template, have some kind of structure, but as I say, we can be a little bit open with that. So who does it? It depends on where you are. A lot of practices it's done by GPs, some by practice nurses. Some of you may work in practices with cancer care coordinators who may be doing these now. Essentially, it can be anyone as long as they're trained. They don't even have to be clinical, because a lot of this role is about signposting. So it doesn't have to be anyone in particular, and it's normally the person who's got the most time to give to the patient that often isn't actually the GP. Who else comes with the patient? Do they want to bring a carer, a family member, spouse, anyone who's important to them, child? Again, it's always worth having, now we have a bit more freedom in our consultation rooms to allow them to bring someone that's important to them. How do they want to do it? Do they want it in person? Do they want it over the phone if they're busy and they're working? Do they want it over video if you're happy with video? I personally am not a fan of video, but again, it should be guided by what's best for what the patient wants, not necessarily what we want. And how long do you need? Kind of a golden question that. A lot of these can sometimes get shoehorned in, like I said, to the end of a GP consultation. I think my personal opinion is when I've done them, it takes me at least 20 minutes to do them. And that's often, I find the extra time wherever I need it, but I will always have a separate appointment, and that normally takes 20 minutes, whether I only get 10 for it. But I don't think you can cover it any shorter than that. Maybe even half an hour would probably be best. But I think it's important to notice these aren't quick, kind of easy discussions. You don't know what's going to happen. And again, I said earlier about anyone can really do them who's had a bit of training. It's not about knowing everything and knowing where patients need to go to get signposted for all of their problems. It's about knowing when to seek help, referring to the pharmacist if they've got problems with their medications, referring to, cancer care map I'll talk about again if as a symptom you don't know what to deal with, maybe referring back to the hospital CNS if they've got a problem that's maybe a recurrence. So it's more about a signposting process than knowing everything about the side effects of cancer and chemo. And also it's continuous. Although there's only one tick box for doing a cancer care review, it shouldn't just be a standalone thing. If a patient needs a follow-up in a couple of months or if 6 months, fine. If you need to keep tabs on them, absolutely fine. So it's part of a continual process. Just quickly, a few kind of examples of what the different concerns are that people often bring. So you can see it's not just medical problems, work, finances, mental health. All of these problems affect people with cancer, and it's about making sure we can recognize these and signpost them. They may need signposting. You can use your social prescribers if you have them available to help you, if they may know more about the ins and outs of the finances and the work situation, employment law. If it's pain, it may be referred back to the GP. Say if it's medication, maybe the pharmacist. It's just about knowing if you're comfortable with it, absolutely fine. If you're not, you can refer on to someone who is. So again, various bits of signposting you can use. Cancer Care Map, if you've not used it, is an amazing resource. You basically put in the symptom or side effect and your postcode, and it tells you all the local and national services that are available. So you can use that when you're sitting there with the patient. I'm very happy to be honest about to patients when I don't know something, and I'll say, look, I don't know where you go to get help with this. Let's look it up. Or you can do it over the phone. If you're doing it over the phone, you can sometimes do it while you're on the phone to them. But again, it's a perfectly good resource. We've got Macmillan, we've got Maggie's that you maybe know about, the one in Manchester. Again, you can signpost to any of these, and that Maggie's particularly as well for patients and their relatives as well. Just a quick example of the questionnaire. So if you use the Accurix Florey or Flore, however they tend to say it, if you send them, they'll get this text on the left-hand side, and then when they've done their questionnaire, you'll get all this information on the right-hand side. So you can see you can immediately see that their main issue is that sleep problems. So it gives you a bit of a heads up. And it's just giving you that bit of information in advance. And again, if you've used Accurix, that's saved straight into whichever software you use, EMIS System 1, Vision maybe. And just quickly, so yeah, a few other resources there. So Red Whale I mentioned, Macmillan's Learning Zone as well, Gateway C, I know Sarah Taylor's just been talking, so they've got one about supporting patients as well after diagnosis. I think that's about 90 minutes, which is quite good as well. So I think hopefully that's all I wanted to do, because I don't like seeing the screen because I can't see everyone else / myself. So I'll just turn off my screen share if it's not already. I think it has. So yeah, essentially I was just trying to have a quick whistle stop through cancer care reviews. What I really wanted I guess, to know as well was A, any questions, and B, what we kind of as a Cancer Alliance can do to help. Are there any barriers that you feel there are to getting involved with cancer care reviews and where you guys are? So yeah, I'm happy to take questions. If people are feeling a bit, it's hot and it's getting late in the afternoon and not particularly keen, I do have an alternate method of communication if people would rather not kind of unmute. But I'll see if anyone wants to have a quick unmute first and voice any questions that they might have.
Could you do a cancer care review as part of a group consultation?
That's a good question. I personally, I don't see why not. I don't think it's not something that I've ever heard of anywhere else doing. Partly because they're so, I guess, group consultations normally work, from my point of view, quite well when it's all kind of similar problems, whether it's, I guess, diabetes, high blood pressure, cholesterol, obesity. So the information giving is very generic. Whereas with cancer care reviews, I think they are so individualized and personalized. I don't necessarily think it would work. I think they'd be useful from a peer support angle. But I think, and also, again, thinking about the things that often do come out in these cancer care reviews, which can be quite personal, like I say, sexual dysfunction, incontinence, I don't necessarily think it would work. It's certainly not, I don't think it's not recommended, but it's not explicitly said it would be. So I personally wouldn't myself, I think, because I think I'd find it hard and I wouldn't maybe believe the patient would be as open as I think they should. But there definitely should be some areas there for peer support. And there's a lot of peer support groups. Again, if you go on like Cancer Care Map, you'll find peer support groups, often cancer specific as well. So like the Greater Manchester, I think there's a Greater Manchester pancreatic cancer kind of support group where they all have can discuss about that. I work at the Christie as well in oncology, so I have experience there, and I know a lot of them use Facebook groups for peer support, and they'll always tell me about the Facebook groups and what's going on and who's had different treatments and say, oh, they've had this and they've got this. So I think patients do seek these out. But yeah, no, it's an interesting thought though.
Thank you.
Steve, can I ask a question, please? It's Debbie. So we've started doing letters for the cancer support discussion, which is fine, just because of the volume of the patients were a big practice. But what I'm not struggling with is when you then phone the patient, so they've had a letter to say that they're going to have a discussion with me, and it may be, say, 6 or 8 months later following the diagnosis. Sometimes for them it seems like, why are you bothering ringing now? Because I've had all the hospital bit, I'm at the end of my treatment, I'm doing okay. For me, it was much easier to do it in the early days because you had a bit of an excuse to speak to them and say, gosh, you've had this diagnosis, and you can go at it a bit of a different angle. Whereas when it's months and months down the line, I'm struggling a bit of how to open that conversation a little bit. Yeah, because their needs are probably a little bit different, 10 months on to what they were at 3 months on, let's say.
Yeah, no, I think I guess the key although there are these two different ones, I say the big focus is on this later one with the 8 to 10, the 12-month one, the later one. And the reason mainly is that in that initial period, they get a lot of support from the hospital. They'll have their specialist nurses, they'll have cancer coordinators, pathway navigators, their consultants, loads of different professionals who are all trying to help. Yeah. And I think our role in that initial one is just say, look, we're here, we understand what's going on, we've got the information. If you want to talk to us, or here's some information about where to go. And it's there's not an awful lot I think we would normally be offering. And then the idea being that later on, when if they've been discharged maybe, or if they've been kind of put on surveillance, that then maybe they might develop side effects down the line. They're not having regular appointments with their oncology team anymore, and they may say, well, I don't know where to turn. And that's kind of where the cancer care review ideally kicks in. And like you say, it may be that's 6 months for some people, it may be it's 12. It's as long as I guess the initial conversation or the initial offer at 3 months is hopefully more of a, look, we're here at some point later in the year, we'll offer you this cancer care review, or you can come and approach us about it. And then approaching them later in the year about it, just say, look, we just want to see how. And that, I think what I found to say, especially that text message that we use from Accurix, is really helpful, because it really prompts them to, I say, it didn't show all the questions and the options, but it really prompts them to think about other ways that they may have been affected, that they may not have even thought about themselves, particularly regarding like work and finances. I think that people often don't think about so much.
That's great. Thank you so much. Thanks.
I think something pop up in the chat as well while we were talking. Was that Laura? 3-month support discussion. So there is a template on Accurix, I think, from Macmillan. If you put in Macmillan support, I think it comes up. Personally, I'm not a fan. I don't think it has an awful lot of good stuff. What we are looking to do is to create because I know a lot of places have a letter, I think, like you're just saying then, but what we might do is create maybe a GM standard letter that people can use or model on, that includes a few of the local resources as well from a GM perspective. But then we could also make a template text message. Hopefully we might be able to get Accurix to put it on, but it may be something we just need to share. But I think the one on there at the moment, I'm not overly a fan of. So what we'll probably do, we've got a little working group, so we might try and design an Accurix as well as a letter. So I'll take that on board as well. That'll be useful. Is there anything else that would be helpful, from people in the group anyway who are here about doing cancer care reviews? Do people feel they've had support or training? Or do they feel they don't know what they're doing sometimes?
I think initially for me, sorry, it's me again. Initially, I think it was looked at as, okay, are you happy to do them? That's fine. You've had some training. Are you sure you need that much time to do it? Do you know what I mean? I think it was more like, oh, can you not just tag it on and just do it when you've got somebody's DNA'd or something like that. And it's actually taken, no word of a lie, it's probably taken about 2 years or so, because now our numbers have changed dramatically. I mean, they've increased so much that I've now got a designated cancer care review clinic. It works well. I have admin. I do have some admin support as well. So but it's taken all that time. So I think if people are just literally there starting, to do the cancer care reviews, it's not something that's just happened overnight. It does take quite some time, but now I find them so rewarding.
Yeah, that's really good to hear, actually, Debbie, because I think you can definitely tell the difference when people have had time to do a cancer care review and when they've not. Like, I'm sure you've probably seen them as well, and others, that when they're in the notes and they've just been tagged on the end, maybe of a GP appointment or a nurse appointment. It's tick box. It says cancer care review, patient okay, chemo, this, and it's
Absolutely.
Like, it doesn't matter. They've got an oncology team to worry about the chemo. We're there to help them with the other issues of things. So what we're trying to do as well is we're creating a set of standards, which most of which are involved in having a standalone appointment, a planned appointment, a pre-appointment questionnaire, appropriate time. These are not going to be, we can't hold PCNs and practices to do this. They only need to do what's in the QOF. But I think what we're hoping to do as a Cancer Alliance, say, look, this is the standard we want to be providing for patients, and saying this is the level of personalised care, not just kind of here and there and stuff like that. But what I would just do as well, just because I know time is short, and I'm sure that's what Dawn may be saying, but I've just got a link. I'm just going to pop it in the chat now. You may need to open it before we quickly vamoose, but it's just a little bit. It's just a single web page feedback. So if you click on the link, it'll allow you to put in any other bits of feedback. If there's anything that you feel would really help you by giving cancer care reviews, if it's getting enough time at the practice, if it's getting training, if it's whatever it is, it's anonymous. If you just pop it on that box there, I'll look at it later today and I'll take it back to our working group. So if there's any feedback later on, I'd really appreciate that.
I'm really sorry, I don't have access to the chat.
Oh, that's right. I'm sure they can send it around afterwards, maybe, Dawn?
Yeah, I'll make sure it goes out. And Steve, do you want me to pop it in the big group chat as well, so you can get feedback from others?
Yeah, that'd be lovely.
I'll make sure the link gets sent to everybody.
Oh, thanks, Dawn. And thanks everyone else if we're jumping back in, then thanks very much for listening. I know it's been a bit of a whistle stop.
Thank you.
Yeah, we should be moved in a second. I think Claire, I think she's got 113 people to move around. Oh, there you go. She'll be bringing you back in the main room in the next 2 minutes.
Oh, there you go. So you've got 2 minutes. You can submit anything you want on that link there if you have access to the chat. Sorry, Steph.